Welcome back to the channel. Here we are again. Today, part 2 of the dark side of the hair transplant industry. Stay tuned, let's talk about that. Hi, welcome back. So here we are. We decided to do another video on the dark side of hair transplantation industry. The first video was very successful. A lot of our patients and people that watched the videos gave us some good feedback on what they learned from the video, and that's all we want. So this is part 2. We're going to talk a little bit more about the market and some different aspects of it, reinforcing the importance of a physician being involved in your care, or at least a licensed medical professional like a nurse practitioner or physician's assistant involved in your care from the diagnosis of your hair loss all the way through the procedure if that's the case for you. So let me tell you a little story. And this is not something uncommon, okay? We see this time and time again, but we're seeing that more and more now, again, with all these clinics being doing surgery without the involvement of a physician or someone who specializes in hair loss. So this patient came to me not too long ago for a consultation. She's a female patient, had some hair loss in the center of the scalp. You can kind of see here, getting a little bit thin. Also temporal thinning on both sides. She's in her mid-50s, very healthy lady, no other health issues. So pretty straightforward, right? I mean, anybody that sees hair loss with any frequency will look at the hair loss, and if you don't know enough about it, and that's where the danger lies, you would think that this is just thinning hair, garden variety hair loss, and you would say, okay, well, let's do some medications perhaps, and even if you consider doing a transplant to fill in these areas, you may be a good candidate for that. Well, here's where comes the experience. So that's the problem where that you run with people that are seeing patients and recommending procedures and treatments who are not specialized in hair loss, okay? Hair loss can be very insidious. It can be very tough to diagnose correctly. Sometimes if you do surgery on a patient with the wrong diagnosis, the surgery may not work, best case scenario. Worst case scenario, the surgery will not work and it will make the hair loss worse, you know? So if we get a little bit closer to the scalp of that patient in that center area, if you know what to look for, I have 25 years of experience just seeing hair loss. If you know what to look for, you're going to start seeing some things here that will catch your eye. And I'm going to tell you what they are because obviously you're not obligated to know that. So looking very closely here, I don't know how much the camera can show, right around where the roots of the hairs, where the hairs come out of the scalp, there's little swelling areas. Those are called perifollicular edema. So if you're looking for these things, you can see it here, but it's very, very subtle. Little areas, little bumps around the follicles. Getting a little closer even, the bumps are there. You also notice some hairs are clumped together. This is called follicular tufting, okay? There's no redness, the scalp looks pretty normal, you know? Sometimes with diseases of the skin and the hair, you see the scalp very red and inflamed. Not the case here. So this is a patient who has a cicatricial type of hair loss or scarring type of hair loss. It's a very common type of hair loss. It happens a lot, particularly in women. I have to be looking for those things because if I transplant this lady, it'll be a problem. Cicatricial alopecias are autoimmune conditions, and there's many of them out there. And if you transplant these patients, more than likely the transplants are not going to work. And worst case scenario, like I said before, you may actually trigger the disease to be worse. There are treatments for these conditions and you have to treat them, but you need to know what to look for. This is just to highlight how important the right diagnosis of hair loss is. And time again, I see patients who come back to me and say, well, I had a surgery by so-and-so, and it seems that the results were not what I expected. And so I went back and I had a second surgery and the same thing happened too. The results were not good. And then I looked at the scalp and then unfortunately that was one of these conditions that were not diagnosed. So important to know, hair loss is a medical condition, okay? It may not be a disease, the genetic hair loss, androgenetic male and female pattern hair loss, are not considered diseases because they're very common, but there are other types of hair loss that are considered pathologies or diseases. I am actually going next week, as of the recording of this video. Today is October 19th. Next week we have our big hair meeting, the International Society of Hair Restoration Surgery's annual scientific meeting. It's going to be in Panama City in Panama, and one of the lectures I'm going to give there is about cicatricial hair loss. Why? Because it's very important. We want to teach people to diagnose these things correctly. This is a lecture actually I'm going to give to the candidates for the board exam of the American Board of Hair Restoration Surgery. We will do an exam for the board, for the physicians who want to be board certified during that international conference, and I'm going to be one of the examiners. So this lecture is one of the ones I'm going to give during the course there, during the congress, and it focuses on cicatricial alopecia. Just to show you a small list of cicatricial alopecias or alopecias in general, this list here, it's all the diseases that you can have that are classified as cicatricial alopecias, okay? Each one has its own clinical features, its own history, its own presentation. Some of them can be similar, and that's why it takes experience to diagnose them. But look at the list. And this is only cicatricial. There is a whole other list of alopecias or hair loss that are called non-cicatricial alopecias. So non-scarring hair loss. Also autoimmune hair loss that don't cause permanent loss of hair. Cicatricial or scarring alopecias cause your hair to be lost forever in those areas. So it's important to diagnose early and correctly. The most common examples of non-cicatricial or non-scarring hair loss are the androgenetic, the typical male and female pattern hair loss. There's no scarring on the scalp, so the inflammation is very, very low grade. The other one is what we call alopecia areata, which is when patients have little bald areas, usually circular areas, one or more of them, in the scalp or the beard or any other areas of the body. But there is a big list of other non-cicatricial alopecias. This is just to highlight to you how important it is to have the good diagnosis. If I'm a salesperson or I'm not experienced in these, I'm going to look at that patient and say, well, yeah, come in for a transplant because your hair loss is pretty typical what we see, right? Because that person does not have the medical knowledge to look for these little signs. No matter how experienced they are, we go to medical school and residency and fellowship for a reason, right? Because these things take time to learn. And if you're looking into surgery for everybody, then you're going to miss these things more than likely. So it's very important. Hair transplant surgery is real surgery. It's not a non-invasive, easy procedure that you can do in the back of your house, okay? A lot of times on the internet you say non-invasives, non-scarring, or procedures that are easy to do. None of that is true. Hair transplant surgery, in fact, is very complex. It takes a lot of good planning. First of all, it starts with the right diagnosis, right? That's how anything starts. If you diagnose somebody incorrectly, now you're following a path that's going to lead you to nowhere or lead you to poor outcomes. If you have the right diagnosis, then you follow that path and you're going to be successful. It may not be what the patient or what I wanted as far as, I'll be able to give you more hair, but at least we will know what we're treating and we can offer the best options, okay? So it's very important. Hair transplant surgery is not simple. Medical technicians that are non-physicians, non-licensed to do actual harvesting of grafts and placing of grafts are not trained, no matter how experienced they are, they're not trained to evaluate the donor zone, how much hair they can remove safely, how to plan for future hair loss. They're not trained to follow the correct angle of the hair. They're not trained to put the hairs in the right spots. They're not trained to account for future hair loss. So these are things that only a physician with training can do. And I say a physician, also a physician's assistant that has been trained, or a nurse practitioner. So you have to be very careful with that, again, because with the black market or the illicit clinics, a lot of these technicians are doing surgery. Some of them may be very experienced and have been doing surgery, assisting in surgery for a long time, and they're very skilled. But that doesn't mean that they can do everything for you. They shouldn't do that anyway. So Complications happen, right? It happens to all of us. It's a old saying in surgery that if a surgeon tells you that he or she has no complications, you can be sure that either he or she is lying to you or they're just not operating enough. If you do enough surgery, you're gonna have complications. The key is not to be afraid of the complications, is to be aware of them, know what they are so you can prevent them, and when they happen, you can treat them at the right time, as soon as possible, with the right techniques. And you have to be a surgeon, an experienced surgeon, to know these. And that's true for every surgical specialty, okay? If you go to a heart surgeon for a heart surgery, he or she are going to be thinking about the possible complications that you're going to have, try to be proactive to prevent them, and if they do happen, they're going to act right away. Same thing here. When you come to me for your surgery day, before that even happens, I'm already planning your surgery, where we're going to be doing some adjustments in the pre-op depending on what you have clinically. During the surgery, I make adjustments depending on your age, your health status, and everything like that. Technicians don't know any of that. They'll give you medications that may or may not be dangerous for you. There are specific doses of lidocaine, anesthetics, and sedatives that are safe for a patient. A patient with a heart condition has to be adjusted for medications. A patient who is older has to be adjusted. Technicians don't know that. So you're putting your life truly at risk by allowing yourself to have surgery by non-physicians, okay? So I call this the Wild West, right, of hair transplant surgery. It's terrible. It's lawless right now. Everybody's doing whatever they want. They're marketing their services, marketing hair transplant services where the physician is not even in the room, doesn't even know what's going on in there, and patients are being done or operated on by non-medical personnel. I'm sorry. By definition, right, what are the roles of a surgical team for hair restoration surgery? Don't get me wrong, technicians have been used for many, many years to assist the doctor. I've had assistants, and I have assistants here that have been working with me for a long time. These are very skilled, very experienced people. They have an important role in your surgery. A lot of times they'll be the ones dissecting the hair that I remove. If I do a strip surgery, they'll be the ones dissecting it on the microscope while I'm working on making the incisions or creating the design of your transplants. A lot of times the technicians will do most of the placing of the follicles that I harvested back into the incisions that I created. So that's an established practice. It is done like that in pretty much everywhere. If I do an FUE procedure, I will be harvesting the follicular units, the hairs from the back of the head, because that's under my control. It's something that only I can do as a physician and surgeon. The technicians will help me count the grafts and count the hairs and help me pull them out from the scalp, but the punch, the cutting surface, the cutting tool is in my hands, okay? I never allow them to make incisions on your scalp because that's not under their purview. Every incision that I make has a reason to be that way. It's not like this because of a reason, it may be like that or maybe like this. There is a rhyme or reason that comes with my experience and my eye and my vision for your results. You don't get that from a technician, okay? Technicians also not trained in anatomy, basic anatomy, the skull. If you're not, or the scalp, if you don't believe me, ask any technician to describe to you the anatomy of the scalp. Mine probably can a little bit because I teach them that, but I guarantee to you, many of them will not even know how to name a nerve or a blood vessel that's under the skin that they're cutting. So it's very serious, okay? So what happens when the roles are reversed? I had a video here that I was going to play for you. Let me go back and try to restart it. There you go. So this is our team here, right? You see me, the patient is here, very comfortable. I'm wearing all the gowns and all the protection to make your surgery safe. Obviously, infection is a risk of any surgery, right? So we try to prevent it. We try to prevent infection. So here I am, my team is here. I have two of my team on that table loading the hairs for me to place. There's another two girls right here on the microscopes working on the tissue. So those are roles the assistants are trained to do, to help me, not do things for me, okay? What happens when the roles are reversed? Disaster, right? Because like I said, even doctors that are inexperienced make mistakes. Okay, when I started doing transplants, I'm sure I made mistakes too. But being a surgeon and a doctor, before I even touched a patient, I studied the scalp anatomy. I saw a lot of people doing surgery and asked questions and worked under someone before I even touched the patient. That's just a basic responsibility for me as a doctor, okay? I'm not gonna take my first patient in there by myself and just trust however many surgeries I've seen and know that I can do it. Very complicated. So it takes time, it takes effort. This is, about planning of the donor site. So these patients, are pretty much done. This is an infection that happened here. Why? Because there's no understanding of planning. There's no understanding of hair density, of, how many hairs you can have, the hair caliber, the hair type, the hair curl, everything, potential for hair loss. So when you come to me for a surgery, in my mind, I'm thinking of all these things, both today and 10, 20, 30, 40 years in the future. Technicians are not trained to do that, no matter how good they are with their hands. Okay? That's why, again, we and the International Society of Hair Restoration Surgery, we created the World Hair Transplant Repair Day. That's November 11th. I'm one of the volunteer physicians. There are many other ones around the world. So if you or anyone that you know had work done by technicians or by illicit clinics, illegal clinics, and you have a problem with your transplant, either the results are not natural, whatever it is, come talk to us on November 11th. We will do a free procedure for patients who were harmed by these clinics. It's our way, the International Society of Hair Restoration Surgery's way, to raise awareness and to give back to patients, because we want this field to be safe. We love what we do, we've been doing it for a long time, and unfortunately, because these people are doing these things out there, it's really hurting all of us, mainly you, the patient, because you have to walk around with results like that could have been prevented. Okay? So, in conclusion, like I said in the other video, in part 1, do your research. When you go for your consultation, okay, you saw a sales consultant or a consultant from the practice or patient educator, whatever it is, fine. They're gonna give you the idea of the practice, and that's all okay. But they should not give you ever a surgical plan or a treatment plan. That's my job as the doctor to do that for you. So do not walk away from these consultations with a surgical plan or a treatment plan without having seen the doctor, okay? If you do, I recommend you don't go back, okay? Because again, probably 8 times out of 10, it'll be all right, although not legally right, but it's gonna be fine. But there is that chance that that person, because he or she is not a medical professional that's trained to do this, that has the eye, the clinical eye, to do the right diagnosis, there's a chance that something will be missed, and then you will pay the price later on, okay? So it pays to do your research, and if you have the surgery, make sure before anybody touches you that you actually are sure that a doctor, a physician, a physician's assistant, or a nurse practitioner is going to actually be doing the critical parts of the procedure for you, okay? Don't settle for less than that, because the consequences can be dire, all right? This was a long video, I know, it's kind of a rant, but I wanted to put this information out to you and hopefully help you avoid disaster, okay? I'm here, give me a call, we can do virtual consultations. In the office consultations, they're all free. I'll give you some advice, okay? Stay safe, I'll see you next time, take care.